information. The report high risk, low benefits for the nation's restaurant workers and their impact on the consumer. It covers the plight faced by far too many workers in our food service industry. It's a real eye-opener on a lot of fronts. And just a point here, in terms of my own background, I come at this issue with regard to workers honestly, if you will. My mother was a garment worker, so I had the opportunity to see what her circumstances were when I went to meet her every day after school. And I was, who knew as a kid at that time that the method of my mother's madness was to have me go and see these conditions with women with their bent over the sewing machines trying to pump out the dresses as fast as they could because they were piecework. And they had no benefits. They never even ate their lunch, you see, half-eaten fruit there. And if you got the needle in your finger what happens with garment workers, because those machines move very, very quickly, you never went and got a tetanus shot. You went and you just wrapped your hand up so that you could, in fact, continue to work, because if you got any blood on the garment, it was over. You didn't get paid for that piece. And so that is where I come from, this issue, understanding what happens to people in these kinds of conditions. So you've got millions of food service workers, many of them immigrants and minorities. They work in unsafe, unhealthy, unprotected environments, and they have to contend with dangerous working conditions, employment law violations, and very little in the way of benefits. According to this study, which you will hear, close to 90% of the workers surveyed did not receive health insurance for their employer. This is a troubling statistic that I hope, when people ask, how do we address this? My hope is that the Affordable Health Care Bill that we passed in March will soon help to redress this issue. The Department of Health and Human Services is working on health care implementation right now, and many restaurants will soon be eligible for the tax credit to help them purchase coverage for their workers. That was the reason that we wanted to pass this legislation. And restaurants that cross a certain threshold of employees, that's 50, will have to buy insurance for their employees. Still, there is so much that we can do and to help with regard to restaurant workers so that they get a fair shake that they deserve. They work hard. They work very, very hard. And that includes what we need to do there is passing paid sick day for all Americans. And according to the study, again, almost 9 out of 10 food service workers, 88% have no access to paid sick day. And since the median wage for restaurant work is less than $9 an hour, that means that these men and women cannot afford to take a single day. They can't do it. And in these economic times, it's ever more poignant. As a result, you've got close to 2/3 of restaurant workers, 63%, reported cooking or serving food while they were sick. 63%. You go to a restaurant, you're hoping to get a good meal, you don't think about the folks who are preparing it and what their state is and what their condition is on that day when they go in, because they can't take a day off if they get sick. Even notwithstanding the workers who have to fight off illness on the job, it's a food safety issue, and I spent a lot of time on food safety issues. Food service is not an industry where we want to have employees showing up for work with some sort of a contagious virus, some sort of an infection. We play by fire. We play with fire if we let the situation continue. So I just will harken back to the H1N1 epidemic. And thankfully it was a dry run for what might happen if you had a more dangerous contagious sickness. No, we saw the public health officials on the TV, we saw the president, vice president, everybody on TV saying, don't go to work. Don't go to work. I was remarking before, you got a whole lot of women commentators on the air saying, women, they just shouldn't go to work. How nice for you to say you've got health insurance. You can take a day off. Nobody is going to care. You're going to get paid. Without a thought to what's happening in the lives of families today. They can't take that day off. It's impossible for them to do it. And that is not just in the restaurant industry. It is widespread. You've got 57 million American workers, including 79% of low-income workers, can't take a day off when they or their children or their child or their mother or so forth are sick. They just can't do it. So we have a situation where sick men and women would not only be forced to come to work, they would be preparing and serving food for others while being ill. And it is a recipe for disaster. We need to do right. This is the right thing to do. That is fundamentally what this issue is about. We need to do right by these restaurant workers, not the least by making the Healthy Families Act the law of the land. The bill requires employers with 15 or more workers to provide 7 days of paid sick leave annually for their own medical needs or to care for a family member. We're not asking for 3 weeks, a month, it's 7 days. 7 days. This is something, by the way, that 145 other nations, including 19 of the top 20 most economically competitive countries in the world, that is to say every one but the United States, already does. They do it. I don't see them falling into the sea. I don't think